Every time someone undergoes plastic surgery, they have to be aware that a complication could happen. No one believes it's going to happen to them. Nobody does, but it can. So I think that's very, very key, is you want to know what kind of complications that might occur and what are you going to do about it. Do you have the money to fix a complication? Do you have the wherewithal? Do you have the support mechanisms if a complication does happen? So patients never think it's going to happen to them, but it can. Complications can happen in plastic surgery. Well, the most common complications from plastic surgery tend to be infections. When everything's healing, but oh, look, there's a stitch and it looks like an infected pimple in the stitch. So you have to go back to the doctor and he has to pick off the pimple and take out the stitch. Most complications are very minor. And there are things like that, taking out a stitch, maybe redoing a small part of the incision. Disastrous complications are very, very rare, thankfully. And in a good office, if you have a good doctor and a good anesthesiologist, those complications are going to be remote.